Welcome to this edition of Healthy Living. I'm your host, Tim Kelly. We're joined today by Dr. Todd Wagner, who is a director with the Virginia Department of Health, Western Tidewater Health District, to talk about sort of where we are as it comes to what the health district is doing to help our community during the times that we're dealing certainly with COVID-19. Dr. Wagner, thanks for being with us today.
Great to be here, Tim. Thanks for having me.
Let's start kind of an overview perspective. When we talk about the Western Tidewater Health District, what role does your organization play in sort of overseeing and managing kind of what's going on in the community when it comes to COVID, as well as, again, sort of those oversight responsibilities in a general sense that we're looking at from the health district perspective?
Thanks, Tim. Great question. Obviously, our primary responsibility for the four areas that we're responsible for, which is Suffolk, Isle of Wight, Franklin, and Southampton counties. Our responsibility is to obviously protect the health and welfare of the citizens of that area. And we do that through a variety of different means. Obviously, what we're doing today, education and communication with the public. We're also meeting a lot with community leaders and others throughout the district to make sure they're well informed. And probably most importantly right now, we're doing a lot of case and contact investigations. So if we have positive cases of COVID-19, we find those cases, they're reported to us via laboratory results, and then we find out the contacts of those individuals that are positive, and we make sure that their close contacts are identified and can educate them and also inform them on what to do next. So those are our biggest roles.
How does your agency coordinate with, municipal governments, local governments, healthcare providers? Certainly, from our perspective, the city of Suffolk and Suffolk Fire and Rescue when it comes to a coordinated response to sort of what we're dealing with in the community here.
Right, absolutely. Very important part of what we do, as I mentioned. Biggest thing we do, is just communicate, and we do that on almost a daily basis. I'm in touch with the city managers, the county leadership, make sure that I also have an emergency manager who's in daily conversations with their emergency management personnel to include fire, police, etc. So it's very important. We're in constant communication. Prior to all this, we were obviously doing a lot of drills and preparation, looking at each other's disaster management plans. But now in a real world event, we're making sure that those plans are working. We're in constant communication. If they need any expertise, if they need equipment such as the PPE you've been hearing about, we try and support that. And any type of other guidance or questions that they have that need to be answered on the state level, we can relay or liaison those questions up to the Virginia Department of Health and get them an answer. So that's the biggest part we do.
Definitely seems like a team approach between all the agencies working together, certainly to manage this as best that everyone can. And speaking of managing, when we talk about the individuals in our community and certainly in the Western Tidewater Health District, I use the word advice, and I'm not sure if that's probably the best term, but advice that you could offer when it comes to continuing with the social distancing and the self-protective measures that we've all heard a lot about, as far as where we are at this stage of the game, what people need to continue to be doing to keep themselves and their neighbors safe.
Right. Very important. And folks really are doing a great job within the city and within the district. I can tell you, that the numbers bear that out. We're doing a fantastic job. And folks, I know it's not easy, but folks are doing a very good job. I guess the thing I would add, or maybe some advice or recommendations I could give, was that it's very, we have to be sure that it continues. I know people, as time goes along, people tend to get, as we all do, a little bit more complacent, get a little bit more eye off the ball a little bit maybe, but we need to stay diligent. We need to make sure that people, I think that something that's changed of late is the masking recommendations, personal masking or face coverings that you can use. And the reason for that, it's not really to protect yourself. Those have not been found real effective in protecting yourself, but what you're doing is protecting others, because you may be what we call an asymptomatic spreader or shedder of the disease, and you want to make sure that you're protecting others. And so that's definitely one I see as I travel around. I see not as many people as I would like minding that advice, and I would really like to bring that home. I know it's a little uncomfortable. Find something that's comfortable, find something that you can tolerate, and use it. Anytime for sure that you leave the home, anytime that you're going out, and I know folks still need to travel to the store to get food, to get medicine, things like that, but make that. And I guess the last thing I think is think about the trips you're taking. I know we're not completely locked down. People, like I said, can still travel to the stores. They can still travel to get medication, etc. But try and consolidate those trips and try and minimize those trips to the greatest extent possible. It's just not, to go back and forth like we often do when times are not like they are now is just not the best situation. So I'd really advise people to think about the trips that they absolutely have to take, minimize those trips, and utilize the social distancing and personal, the personal protective advice we've been giving as far as hand washing, sneezing into your sleeve, etc. But again, think about minimizing trips if you absolutely, and only do that if you absolutely have to go. So those would be additional advice I would give. So.
And certainly, I think we all understand the fact that the things that we're doing, the community is doing, it's a community approach to this because it's a community problem. And the sense of doing the things about the social distancing, being smart, as you said, about the trips that you have to take and not just out just for no particular reason. You have a purpose for what you need to do. But it's pretty safe to say, correct me if I'm wrong, that these things that the community has been doing in the Western Tidewater Health District certainly has helped control the spread of this. I know we hear about stories about different things, but I think it's safe to say this has really made a difference and will continue to, with people, again, doing things to help themselves, but more importantly, not more importantly, but in association with helping the community as well, correct?
Absolutely. No, and the numbers bear that out. We're not without cases. You will see cases reflected. I was going to, at some point in the discussion, talk about our VDH website. On that VDH website, there are daily counts, if you will, of cases and unfortunately deaths that occur due to the virus. But as you can see in that data that's presented, our cases continue to, although there are cases, they continue to level off. And so it's apparent that the recommendations we're giving and the work that the public is doing is making a difference. We're looking towards, the governor hasn't given official orders yet, but as we begin to sustain that level, those levels that we are right now, we'll be able to look at opening things back up more in the future. But for right now, it's definitely apparent that the things the public is doing are making a big difference.
I know that we're a month to 6 weeks or so into sort of how we've been dealing with this here in this area of Virginia and the state of Virginia as a whole. But, and people may have kind of thought, well, we're out of the woods. I don't need to worry about, but people still need to be concerned with the fact that if they have certain telltale symptoms, and I know that package has sort of evolved a little bit over time to expand itself. It's not narrowed, it's expanded in the sense of, okay, at what stage of the game do I need to go ahead and take the measures that need to be taken, and also coordinating with my own healthcare provider to find out about testing and things like that. Again, we're a month, 6 weeks, as I said, into this, but what are some of the practices that people still need to be considering with regard to, or do you have symptoms or things that may indicate that you perhaps have COVID-19 and need to be checked out?
No, great. Another great question. And I think people over the course of time, as you mentioned, have become pretty familiar with some of the symptoms, which still we're looking for to this day. And that includes fever is one of the big ones. You can subjectively measure it with a thermometer, a cough or a shortness of breath. We've also learned over time, over this last few weeks, that there are some other differences a little bit too between people. A lot of people see sore throat. A lot of people unusually kind of have a newfound loss of smell or taste, which is kind of an unusual symptom that somebody might notice. Body aches. Some people get rigors or sort of a shaking that they're not as used to, often associated again with a fever. But in some of those, a person, if they're not feeling like they normally do, or they have a fever, or they feel like something just doesn't feel right here, they certainly can get tested, and they should get tested. Now, that does not necessarily mean they'll need to go into the hospital or be admitted to the hospital. And we advise those people as they're going for testing to contact the emergency room or their primary care provider, the urgent care, where they're going to get testing, because it's very important that they know that they're all pretty well set up to receive now. They're all in appropriate protective equipment, but it's good for them to know that, hey, we have an inbound patient that's describing that they may have symptoms of COVID. So we want to make sure that that they're aware that you're coming. But and obviously, if something is getting much worse, if a person's remarkably short of breath, they start getting bluish lips, they become, they aren't responding normally, they're not communicating normally. Those are much more severe symptoms. Definitely need to be taken into probably an emergency room or 911 called, because those are sort of the more serious presentation of some of the symptoms we've talked about. But the other symptoms I described certainly warrant testing, and we're actually wanting to test a lot more people now to get a better idea of what the prevalence of disease is out there. So if you have any of those symptoms as I've just described, you're going to probably be tested, and that gives us a better picture of what's going on out in the community. So I would definitely recommend having called in advance that they go in and get tested by their primary care, or usually it's primary care setting, urgent cares, and emergency rooms. We try and utilize emergency rooms last, obviously, because we want those facilities to be more available to those that are in significant distress in an emergency room also. So.
And I know you mentioned earlier about certainly as we find ourselves in the midst of the COVID-19 and the situation we're in, but the preparations and things in the table, maybe, even tabletop exercises that the Department of Health, certainly the city of Suffolk and other entities do throughout the years to prepare for situations like this. And every situation is a little bit different. So there's some common threads that kind of weave themselves through there. But and I don't want to make you break out your crystal ball, but so to speak, down the road, sort of what lessons do you think will be learned through this situation that we found ourselves in? As I said, dealing with COVID-19, certainly something that I don't think any of us in our lifetimes have dealt with something quite on this level. We talk about flu season and the impact of that. Certainly some other diseases that have come and gone, no, I mean, not gone, but come into our forefront in recent years. But this one certainly has been unique, as all of them have been. But the lessons that can be learned from an experience like this, in case, or very well if we have a second wave or something come back with what we're dealing with now, or perhaps a new culprit down the road that kind of shows itself in similar fashion?
No, great question. And this has really been, it's obviously not been an exercise, but I feel like having gone through, we endeavor to prepare as we always do, as I mentioned before, and you reiterated with different tabletops and drills and things we do. But I can tell you, it's like a sports team. Your practice is great, but nothing can prepare you for the game until you get in the game. And this preparation and this the things we've gone through this last few weeks, I think will definitely and has definitely prepared us for any future contingencies. Like you say, we just as you move through the different situations and the different questions that come up, nothing's better than actually living the real event. And so we've certainly done that. We've done that in collaboration with our partners. The communication that's necessary, we've checked and modified and gotten better at that. It's just it'll make us so much more prepared. It's not that anybody wanted to have to go through this to be able to prepare, but I can tell you, having gone through it now, if there are any future situations, and these things, tend to come back, from time to time. In 10 years or so ago, we had the H1N1. We've had different situation like this, SARS, MERS, things like this that we've dealt with. And should we, and if we do have, flare-ups as we begin to come off the backside of this current event, and we go into the future, and there are, maybe spikes or embers that sort of spark up, I think we're going to be very much more prepared. And I know, I think we're handling it well now, better than we were 6 weeks ago. And I know that's going to prepare us very well for the future. So I feel very confident in that.
And I know you mentioned earlier on about the VDH website, which has certainly been a great resource for people around the state. Again, you talk about the daily numbers. I believe 10 o'clock in the morning generally is when we see those numbers kind of reflected on there, and some of the data with regard to the cases and the numbers and everything like that across the state. Certainly, we might be more narrow focused on Western Tidewater region, but that information is still there. But there's a lot of other great resources on that website as well. And I know you mentioned it, and I just want to give you a chance to kind of talk about some of the other things that kind of come into play with that. And I know that resource has evolved as we've gone through this. The numbers were in one form, and they certainly elevated, and the amount of data that's there, if people really want to dig through that, it's pretty incredible to see. And again, to get a marker of kind of where we are at that moment in time.
Appreciate that. It's the VDH, Virginia Department of Health website, www.vdh.virginia.gov. And as you mentioned, new additions. In fact, just yesterday they added a section called COVID-19 and You, and it's a very interactive type display where people can go down. It's got a great frequently asked questions, and you can click on if you're looking for testing sites, prevention tips, all kinds of information that's very particular to if you have a particular question within that area. So I highly encourage people to go on there. It's a great resource, as is the CDC website, but closer to home, the VDH website I find is very informative. In fact, like I mentioned, even more informative now over the last 24 hours. This just came on, I think, this morning or last night. So I'd encourage your viewers to go on there and take a look at that. I think they'll find it very helpful. So.
And Dr. Wagner, I just want to say again, thank you to you and the men and women of your division and for everything they're doing, everybody throughout the Virginia Department of Health, in fact, for the leadership that they've shown in this situation that we found ourselves in, and giving us the information, giving us the tools. And again, I go back to the fact, really, the information to know what's going on, what steps we need to be taking, reinforcing the steps that we've already taken, and the fact that we need to continue on that path so we can get through the situation as quickly as possible to the best that we can, limiting, of course, the amount of infections, certainly the amount of deaths in our community and across the state of Virginia. But again, I thank you and your staff for all the work you're doing, continue to do, again, to provide the leadership and guidance while working with the city of Suffolk, Fire and Rescue, Police Department you mentioned earlier, so that everybody's on the same page and understands kind of really what we're dealing with here. But again, thank you for your time and again, all the work that y'all are doing.
No, greatly appreciate it, and really appreciate the opportunity to speak with you today.
Very good. Well, that would do it for this edition of Healthy Living. I'm your host, Tim Kelly. We will see you next time.